the most important instrument is the optics. So you need telescopes. This is 0 degree, this is 12 degree, this is 30 degree, and this is 70 degree. 0 degree will have straight vision. This is mainly for examination of urethra. 12 degree will have little oblique vision. This is mainly used in a smaller resectoscopes. 30 degree is the universal telescope that is required for TURP, and if you have only one telescope, this is the telescope that will be your workhorse telescope. This is also known as forward oblique. It looks little down. With this you can also look forward and down. And this is the 70 degree telescope. This is useful for evaluation of post-prostatic pouch in a patient with large median lobe. This is very rarely used. The TURP sheets come in different sizes. This is the 16 French TURP sheet. This is 19 French. This is 22 French. This is 24 French. And this is 26 French. As far as the water flow is concerned, we get different taps. This is a single intermittent irrigation but a rotatable tap. This is the central valve. This is the standard old intermittent irrigation sheet. Only one tap which acts as an inlet, and for outlet you have to remove the working element. This is the continuous irrigation non-rotatable sheet. This is the water inlet, this is the water outlet. The water comes out from here, and then from here the water goes out and drains through this sheet. This is the continuous irrigation resectoscope sheet but a rotatable one. So this you can rotate the inner sheet. The working elements for the TURP also come in two different forms. This is the active, also known as Baumrucker system, where the movement of the loop is by your fingers, and this is the passive, where the recoil of the loop is by the spring. With the thumb action, the loop is going out, and when you retract the thumb, the loop is coming in. This is also known as Nesbitt system. So these are the obturators which are known as standard obturators. These are not visual obturators. You have to pass the instrument in the urethra by tactile feedback, whereas this is the visual obturator. You can put in your telescope through the visual obturator, and you can observe the passage of the instrument through the urethra with the help of visual obturator. Now we will assemble the standard TURP set. This is the inner sheet, this is the outer sheet. You have to mark these zeros, put in the inner sheet, and this is locked. Through this assembly, our visual obturator with the telescope will go. Here we will be attaching the light cable, and now this becomes the complete assembly. We will be attaching an inlet tube here, and outlet tube will be attached here, and this instrument is passed through the urethra under vision. Once we confirm the passage in the bladder, then we remove this visual obturator, and through this we will pass the working element with the telescope. So this is the assembled resectoscope, and we will be attaching our diathermy or a cautery attachment to this resectoscope. Light cable here, inlet here, outlet here. Now this is the complete assembly for the TURP. The loops for TURP come in different forms. This is the double stem, only one active electrode. This is a monopolar. Single stem, monopolar, only one active electrode. Whereas this is the bipolar loop, whereas these are the two active electrodes in this sheet. And different cables. This is for the double stem loop, this cable is for the single stem loop, and this is for the bipolar TURP. Few other instruments that are required in TURP: urethral calibrator. This is the Otis urethrodome. Whenever you are not able to pass the larger sheet, you have to do a urethrotomy with this instrument. This is the Reuter canula, which is used for continuous irrigation when you are using a single lumen sheath like this. This has got only inlet, there is no outlet. So if you want to do a continuous irrigation TURP with this sheath, you have to use Reuter's canula. Once you have done with the TURP, you need to remove the prostate chips. So this is the Toomey syringe, which will lock with your receptoscope sheath, and this is another evacuator which will lock with your sheath. Once you have finished the TURP, you have to put in a urethral catheter, which you can put just like that, or if it is not going because of the angulation, then you have to use catheter introducer. There are two different types of introducer. This is the wire type catheter introducer. If you have a smaller catheter, this another catheter introducer. The catheter will fit here, the eye of the catheter will fit here, and the catheter will fit in this slot, and this again has to be passed like a Lister dilator.